All right, let's go over the eating disorder packet. This one's fairly quick. Oops. So the first one that we're looking at is our anorexia nervosa. This is going to be that intense fear of weight gain. They're going to be so preoccupied with their weight, losing weight. It's almost going to be everything they can think of. It can be restrictive, meaning that they just don't eat. They restrict their intake, or it can be binge purge, where they have those episodes of binging and purging as well. Our assessment, we want to make sure that we're assessing our patient's perception of the issue. See where they're at. What are they thinking? How are their feelings about it? We want to assess their eating habits. How often are they eating? Are they eating? Because this is how our frequent assessments, we're going to see if they are improving by assessing this. We want to assess their support systems. Who is supporting them? Who are they helping? Because 9 times out of 10, when someone has an eating disorder, they are not communicating this stuff with anybody. They're not talking about it. They are not any of it. We want to look at their lab work, because remember, a lot of their stuff, they're going to have a lot of malnutrition. These guys are going to be itty bitty, skinny winny. We have to worry about lanugo. This is that fine downy hair that grows on the skin. It's to try to keep the body warm, because they don't have enough fat on their body to keep themselves warm. And then we also have to worry about refeeding syndrome. So refeeding syndrome happens when we start refeeding too fast. The body kind of goes into overdrive because it doesn't know what to do. So what will happen is we'll get that fluid retention, the electrolyte imbalance. We're going to get fluid issues. That fluid retention is going to hit on the heart, so they can have dysrhythmias and heart failure. We're going to have hypokalemia, hypomagnesemia, and hypophosphatemia. So we're really worried about refeeding syndrome. That's why we really need to go slow. And when we start refeeding, we need to be assessing for this very regularly. And this is the other reason why we want a slow weight gain. We do not want a fast weight gain. Okay. Some of our manifestations are going to be wearing those loose fitting clothes to try to cover up their bodies. They're going to have dramatic weight loss. Like I said, these guys are going to be super skinny. Because of that, they're going to have the sensation of menstrual cycle. We talked about electrolyte imbalances, and this can be very deadly. Y'all know potassium. It can really hurt the heart, whether it's high or low. Sodium can cause seizures. So we got to be really diligent about checking these electrolytes. They're going to have a hyperfixation on their weight, maybe always looking in the mirror, trying to, their only goal, their only thought process is how much they weigh and what's going on with them. And then a lot of times we have the excessive exercise. So hyper-focusing, they may run 6 miles a day. So we got to be mindful about that. And then we have our bulimia nervosa. So this is going to be when our client eats a large quantity of food over a very short period of time. And this is going to be followed by inappropriate compensatory behaviors. So these compensatory behaviors can be purging, laxative use, diuretic use, anything like that. So it can be purging, which is when you induce vomiting, or non-purging, where your compensatory factor may be diuretics or laxatives. So our assessments are pretty much the same, except for we want to look at what triggers their compensatory behaviors in this. Manifestations, because they are intaking a fair amount of food, their BMI is typically going to be normal. These guys are not going to be underweight. We're going to go between our binges. We're going to have food restriction, and then we'll binge again. Electrolyte imbalances, this can be from laxative use, diuretic use, y'all know that from pharmacology, the purging, the different acid-base imbalances that come along with that. The act of purging and that acid eroding in the throat and in the mouth is going to cause enamel breakdown, which can cause excessive cavities, so dental caries. We got to worry about that. And then we're going to have Russell sign. That's going to be bruising on their knuckles from where they may have been using their fingers to induce vomiting, and their teeth have made marks in their hands. I have added a piece from Nurse in the Making that has our 3 different eating disorders. It talks about refeeding syndrome, treatment, and then it does talk about binge eating. I didn't make a page on binge eating because it's essentially bulimia without the purging. They just eat large quantities of food over a short period of time. And then there's also a nutritional problems that talks about anorexia, bulimia, refeeding syndrome, and malnutrition. So that is what we have for our eating disorder, and that is our tutoring on eating disorders.